what are the best ways to care for skin?
So that's a great question. And, because mycosis fungoides often presents and looks like dermatitis, it's very important to, use very safe, gentle products on the skin. So I think for soaps, we like non-soap products. So what that means is liquid soaps that are not stripping to the skin. Our favorites are just Dove and Oil of Olay or Cetaphil. Those are liquid soaps. Sometimes you don't even need to use a soap or a non-soap product on the skin. You can just focus on, kind of washing the genital areas under the arms and just clean the skin with water. As far as, skincare, again, we like bland moisturizers. Again, we have some favorite brands like CeraVe, Eucerin, Vanicream. They're often inexpensive and very easy to find. And we like those products because they have few ingredients that are that could potentially cause irritation to patients with mycosis fungoides. So when you have active lesions, your skin is compromised. So the barrier of the skin is not intact. And what that means is that ingredients in different skincare products can penetrate into the skin and cause irritation. Hence, mild soaps and bland moisturizers.
I have primary cutaneous marginal zone B-cell lymphoma. I understand the wait and see, but how long or what should you look for to start doing something more? I have a few lesions on my back, one on my shoulder, one on my eyebrow. I had injections on my eyebrow and back. The injection reduced the lesions, but then they returned slowly. Any recommendations on what to do next since the spots are not in one spot? And if we can leave the question up as they answer, it might help.
Dr. Lekowitz, do you want to start? Or I have some things about topical treatment.
Sure. So I think as always, so in terms of cutaneous B-cell lymphomas, there are a number of different things that we look for in terms of concerns for whether this is going to, I would assume, and again, as a general topic, that the person that you've seen has ensured that this is really only on your skin and it is not in other areas. There are a number of different things that can be, as long as we don't find anything else systemically, there are a number of other things that can be done. Watchful waiting is often done. Other things that one can think about, particularly if the lesions are in areas that are concerning or irritating, can be radiation. Can also be, at times we use more systemic sort of therapy, but in terms of, as always, there are toxicities with any of the things that we do, and trying to work at where the lesions are locally and minimizing toxicity is often the primary goal. As for the most part, these lesions tend to be, or the disease itself tends to be something that is chronic, and people are working with and managing for many years, if not decades.
Yes, I'll add my 2 cents on that one. So the good thing about cutaneous marginal zone lymphoma is that it tends to have a really excellent prognosis. Although people may get new lesions, it's very uncommon for them to develop it in a lymph node if it started in the skin only first. And so oftentimes we're deciding whether we want to just watch lesions in the skin or if we should go ahead and treat. So a lot of times if it's somewhere like an eyebrow where you don't like the appearance, where it can be disfiguring, sometimes we can do injections. I'm guessing that's a cortisone injection that you had. Occasionally that can be helpful, but they do sometimes come back. The second thing I tend to go to is to radiation therapy, like Dr. Lekowitz said. One thing I want to mention about radiation is not all radiation is the same. For these marginal zone lymphomas, if you have more than one lesion, oftentimes radiation oncologists are able to do very low dose, and our recommended number of treatments is just 2 for an individual lesion, and it's a very low dose of radiation for each of those treatments too. And oftentimes they will go away completely or for many years, and that tends to be very well tolerated.
For MF stage 1A, using a topical steroid, is it okay to use the cream 1 week on and 1 week off? Will this help the cancer progress or strengthen?
That's a great question. And the truth is, there's actually many different ways to use topical steroids to achieve the end result, which is to stop disease progression. Using it 1 week on, 1 week off is a helpful balance to minimize side effects from the topics, and it might be enough for you to keep your disease at bay. Some folks might need to use it more often, and so it can really be tailored to the individual. And so I would say it is not something that would make your disease worse in any way, and certainly can be helpful. And if that's not working, then there are other ways to use it.
When using topical cream, is the expectation that spots will disappear or just fade? And how long can it take with daily use for patches, plaques to disappear?
Yeah, it's a great question, and it's difficult to answer. Probably this is the most challenging thing when counseling patients. So my hope is that the spots completely go away and the skin is left normal. Some people are able to achieve that. However, not everybody. There are some folks where the degree of inflammation from the disease itself leaves behind discoloration in the skin once it's completely treated. And that discoloration, or it might be a kind of a dusky purple red color, or it might be a change in the texture of the skin. So the disease might be completely gone, but the skin feels very wrinkly and thin. And so while some patients are lucky and the spots go away and the skin looks completely normal, some folks who are able to achieve complete remission and completely get rid of their spots might be left behind with some residual discoloration or texture changes. And your dermatologist can walk you through after treatment. Each different medication, each different cream or gel takes a very different amount of time to work. It could be as soon as 2 weeks for some individuals with topical steroids, or 6 months on Valcor gel. And so it's difficult to say how long it would take for any given spot to improve. It really depends on the medication.